The big problems with vaping is we don't know a lot about it.
Dr. Chris Acker is an emergency physician at CHI Health.
As far as I know, we haven't had any vaping cases here at this hospital.
But the Iowa Department of Public Health said they've received at least 4 cases of vaping-related illnesses among young people.
And some other states like Illinois and Wisconsin have seen some cases of lung injury that's related directly to vaping.
Acker points out that most vape products have nicotine, which can be addicting. That's not the only issue.
Some of the other substances that are part of the vaping product, some of the additives and things like that, we really don't have a lot of information about what are the consequences of that from a health standpoint because it's all just too new.
Doctors say vaping is unlike traditional smoking because they've been able to study the effects of that for decades.
Vaping is new. Vaping is something that we just haven't had enough time to really investigate.
When it comes to the respiratory illnesses reported in Iowa, Acker says they weren't caused by infections, leading doctors to believe vaping may be to blame.
We're kind of left with saying, is it possibly the vaping product itself? Is it something else that's going on that's related to vaping that's causing these people to become very, very ill?
As for Acker, he says there's just too many unknowns. Quinicia Fraser, KETV Newswatch 7.